Why do hair transplants fail? In this video, we're going to discuss the points that would reduce transplant failure and increase success. Number one is selecting the correct surgeon. That's difficult to do sometimes, but I would suggest that you research the surgeon, find out how many transplants they have done in the past. Experience is always an ideal situation you want to see. Don't go to the person who tells you he's done 50 in research. Look at before and after photographs, for example. See the results. Other factors that will contribute to failure is the post-operative care. After the transplants have been performed, it is imperative, it's 50% of the success rate for you to take care of the transplanted hairs the way that it's listed in your post-operative care. So from a technical standpoint, one of the things a good surgeon will do is when he or she is harvesting the follicle, if that follicle is transected, meaning that the harvesting comes at an oblique angle, that follicle is already damaged and should be simply thrown away. Guarantee that if that follicle that has been damaged is going to be transplanted, it's going to fail. A good surgeon will not allow that. He'll throw that away and extract the ideal follicles. Another key point is selecting the proper candidate. If somebody comes in and needs, let's say, for example, our estimate is 1,500 grafts to restore a hairline in the front, and the donor site clearly to the surgeon indicates that the patient does not have anywhere near 1,500 grafts, that patient should be eliminated from the hair transplant because they will not get what they want. They will not get the fullness. They simply don't have enough donor site. So exclusion of the poor candidate eliminates failure.
In order to minimize any the transplant failures, it is very important to work together, meaning providers and patients together. It's like a teamwork. The surgery, of course, is really important, but the post-op cares are as important as the surgery too. Because during those post-op cares, especially within first 2 weeks, it is very crucial that patients have to take good care of the follicles. It takes about 2 weeks for follicles to make connection with the blood vessels. And that's how the follicle, each hair survives. If that doesn't happen, doesn't matter how the surgery went really okay or not, the hair's not gonna survive. So post-op instructions are really, really important. First 2 days, you're not gonna touch your hair. You'll have your first hair wash after 48 hours. It's just gonna be poor technique, meaning you're gonna make either a shampoo or soapy water, and it's just gonna be poor technique without touching the hair. And you're just gonna let it air dry. Basically, the post-op is all about not to touch your grafts until they are really settled in, and that's how they survive, and then you can minimize transplant failure.